And we will transition over. Thank you so much for that great talk on adolescent confidentiality. That was wonderful. We will continue our morning with Dr. Felicia Scott Wellington, Chief of the Section of Adolescent Medicine at University of Illinois, Chicago. Dr. Wellington's slides. Good morning.
Does anyone mind if I share slides? I know, because I like to move stuff around last minute. Will I get in trouble? I just tried to reorder two of them. Is there okay?
No, you're fine.
You guys can say no if it's no. It's fine.
Oh my God, no problem. I'll stop sharing 1 second.
All right, I'll see if I can, because sometimes I'll come on camera to say hi, but sometimes when I slide share, I feel like my computer acts up.
Don't worry, I think it's easier to control your own slides sometimes, so do not worry about that.
I'm going to try this, see if it works.
All right.
Because I like to change things last minute. I just did the order, so hopefully nobody will get in trouble for anything. So let's see. And then, of course, there it is. I'll try to go back to the front. You guys can tell me if you see it, and then I'll start from the beginning.
Yep, go ahead and put it. Let's see. Yeah, it's perfect, Lisa. Great, thank you.
Yay. All right, so you guys can hear me. I can't see you guys, but we will talk at the end. So I tried to set myself up for success because I usually do a lot of slides and I never get through it because I talk so much. So I did less slides, and I hopefully will be able to finish on time to answer questions. And so I'm going to be talking about empowering adolescent patients to take ownership of their health and healthcare. And I just will start by saying I'm tricking you guys, because I know that a lot of times when we see a topic like this, we think that I'm going to give you pearls about what to do in adolescent, but I'm actually going to talk about pearls about what we can do with ourselves to help empower teens. And that, I think, is part of the things that we don't talk about a lot. So my objectives are, I'm going to review adolescent brain development and highlight the importance of transition into adulthood. For those of you guys who have forgotten all your neuroanatomy from medical school or whatever training you have gone through, whether that be NP school or whatever, sometimes if we forget that journey through adolescence and the brain development, we actually are not ourselves equipped on how to help empower adolescents, because we actually forget about their developmental transition. And sometimes we get frustrated with things that we say and things that we do. And us, like parents, we tend to fall back from empowering them. And so remembering adolescent brain development and the transition to adulthood is really important when we're talking about empowering teens to do anything, better yet, their healthcare. I'm going to talk about a comprehensive adolescent exam, because I think that that is something that, the constraints of time and RVU and all those other things, the stress of your day schedule, traffic in Chicago or wherever you live, sometimes pulls us away from the structure of a comprehensive exam, which sets the scene for empowerment of adolescents and young adults. I'm going to review the components just really quickly, because this is a whole topic, a lecture in and of itself, of the WHO adolescent friendly services. And I think that this is important when we're talking about empowerment, engagement with our teens, building trust amongst each other. And so the more that our adolescents and young adults feel comfortable in our setting and with ourselves, the more they are willing and able to empower themselves, especially when we talk about the services. I think that that's important. And I think that it's something that we don't talk about often. And then lastly, it's really going to be a couple ways to outline of how to empower adolescents to take ownership of their own health and healthcare. The background will probably be more important. All right. So I always start off the same lecture. And if anyone has ever heard my lecture, you guys are probably tired of me saying this, but I love starting off this because I think that when you talk about adolescent health and adolescent medicine and what we do as adolescent providers, we get so many different answers and definitions to what adolescence is. I actually recently had one of the residents rotate with me, and I saw a 17-year-old, and she was like, all right, so when are you going to stop seeing this kid? Because he's 17, she's about to be 18 and you need to transition her out. And I was like, yeah, so we can start talking about transition. But, adolescence really is this kind of journey through adolescence. And she was like, oh, I thought that you saw patients that were ages 12 to 18. And I was like, pediatricians also see patients 12 to 18. But yeah, I see patients throughout the continuum because adolescence can be kind of like this journey through adolescence. And so I take this definition, which is like a combination of like a definition from a dictionary, definition from AAP, if you look on their website, and definition from WHO, because it really encompasses a lot of different things. And it says, first and foremost, that adolescence is a journey, right? So it really is this journey from childhood to adulthood, right? And although we like to put ages on it, we know that not everything fits in this perfect box of age, right? So some people say 12 to 21, 12 to 19, 10 to 18. Some people even say up to 25. Those of us who practice in adolescent medicine, many of us see patients up until 25. And the reason being is because adolescence really is this journey through. We know that some people arrive at this journey a little bit earlier, and some people arrive through the journey a little bit later. And it's important to set that framework when we're talking about empowerment, because we have to, one, remind ourselves to be patient, two, remind ourselves that the journey, people arrive at it differently, and three, to remind parents and families who are trying to empower their teen to do things that it is also a journey. And it's marked by so many different changes. I always do this comparison because I have two young kids, ages 5 and 3. And when they were like little infant, as they were transitioning, from infancy 0 to 1, everyone would always ask me to share pictures. What are they doing? What are they eating? Can they walk? Can they crawl? We get so excited about all the changes that are going on in infant's body. But when you look at the changes throughout life, the continuum of life, adolescence is a period that's only second to that of infancy. They're going to changes of their physiology, their psychology, their sociology, neurological changes, and endocrinological changes as well. So their body is changing, their mind is changing, their mood is changing. And yet we don't celebrate them, or we don't kind of like look at them in the same way that we look at that transition through infancy, right? So it's not this period, like we support our infants as they go from 0 to 1. As adolescents journey, whatever age that they need to, through adolescence, sometimes they get a lot of pushback, they get a lot of confusion. I always use this line of saying, you are too old to be doing this. And then the same breath, us, parents, everyone else will say, but you're not old enough to do that. And you can understand how conflicting that information can be to an adolescent. So I'm old enough to do certain things, but not old enough to do other things. And although that might be true, the understanding of that takes a little bit more kind of like finesse in order to help the adolescent journey through that and understand that, yeah, some of those things might be true, but I understand how that can be confusing. And so a lot of times we hear things like, what is wrong with adolescents? They are so illogical. They underestimate risk. They really think that they're invulnerable. They make decisions poorly, and they're just unaware of their dangerous behaviors. And to be honest, although on the outside looking in, it does feel like adolescents move in those ways, they really are very smart. They can tell you. So if you tell them, if you were to get in your car and drive and text on your phone, what could happen? And they can tell you all the things that can happen. I can crash my car, I can, whatever else. And he's like, so why do you do that? If you were to get in the car while you're drinking, what could happen, right? So that if you were to have sex without a condom with the same person that you had sex with, I literally just had this conversation the other day with one of my teams. So you went back in the same relationship and you knew that you took the medicine, but your partner didn't take the medicine? Yeah. I was like, and you didn't have a conversation with him about that? But you had unprotected sex with him again? Okay, so tell me why do you think that you have these symptoms that you have now? And she was able to tell me all the reasons. I know, because I did this, right? But that didn't stop her from doing it in that moment in time. And so it's not that they underestimate risk; they are able to do it. And it's not that they think they're invulnerable. She actually knew that she could probably get it, but in that moment in time, she just wasn't able to make a decision that we would think is a decision that maybe some adults would make. But I say on the flip side as well, adults, they text and drive. Adults who drink and drive, we just have a little part of our brain that helps us weigh the consequences, and we're able to activate that part of our brain a lot faster. And so it helps us with these adult type of decisions. Trust me, I'm going someplace with this. It's not just to bore you about brain development, because I love it so much. But teen brains are different. And I think this is important to know when we're talking about empowerment and we're talking about helping them make healthy decisions and helping them make choices. because we have to be mindful of the fact. So I can't get frustrated at the girl who came in yesterday because she had unprotected sex with the same person that she got this STD from, right? I can't get frustrated. Like, I don't understand why you did that. I understand why she did it, because in that moment where she was with that person, whatever they were doing, all she thought about is connecting with that person. That part of her brain that told her to slow down, think through the fact that they hadn't talked about if he got treated, like all those things that we double think ourselves when we are making a decision, she couldn't access quickly. And so she did what she did, although she knew later that there were consequences of her action. And so, therefore, when I'm talking to her about empowerment of her body and her self care and making sure she stays safe, I have to remember that I need to be patient and be mindful of her stage in development. And so, knowing that teens' brains are different is important when you're talking to teenagers and when you're talking to their family, because a lot of their family has not got training on adolescent development, adolescent brain development the way that we have. And so sometimes we have to be advocates for the patients as well as trying to empower them. So we kind of like have these dual roles in the family situation. So their brains develop, and their brains are different. They communicate in ways that are different. They communicate within itself that are different. Their ability to control their reactions are slower because of this beautiful thing called myelin, which I will show on a different slide. It just starts to rev up a little bit slower it starts to rev up a little bit slower. So therefore, their myelination process happens a little bit later. They're dependent on emotions are still prevalent. So yes, they will cry, they will punch a wall, they will do all those random things that just sound so irrational, because the same reason why I forgive my 3-year-old who literally did this morning when I was trying to get out the house, I put him on his wrong shoes. He wanted to wear the red ones and not the blue ones, whatever reason. He literally fell out on the floor at the door. I'm trying to get him in the car to go to preschool, and he has a fit, right? Like fall out on the floor, tears slob all down his throat, all down his shirt. I didn't get frustrated. I mean, I was frustrated with him, but I knew that that is part of being 3, that they're very emotional, right? And I remind you now that teenagers are transitioning away from that. So some of them are still very emotional. They're trying to learn how to control it and try to learn how to make better decisions. But that part of that brain that is still emotional and connected to that emotional center, or those emotional centers of their brains, are very active, and they are learning how to better control it. And so sometimes when they do things, when they don't do things, it could be based off of emotional decisions. They interpret the world with their emotions first, right? And I say this often because a lot of times we forget about that. An adolescent comes into the office, we are trying to get them to do whatever, to take their medicine, to whatever we look at as being like a marker of them becoming more independent. But we are unaware of the fact that we are typing and not looking at them. We are unaware that we just saw 3 other patients light up on our schedule that has arrived, and the 3rd patient is going to be a really difficult one. And now our face have changed, our demeanor has changed. Adolescents interpret that. They read that in us. The front desk work. Oh, so many times I hear about my patients who are they just come in and they're mad. I'm like, what's wrong? Why are you so upset? And they're like, the front desk worker, when I checked in, asked me whose kid I was bringing in to see. And it just made me so mad. And they are just like mad from, so anything that I tell them, anything that I'm telling them to do, they have already checked out, unless I find space to address the fact that they have interpreted something different. So they interpret the world with their emotions first. And sometimes that dictates what they will do or not do later. And their brains are uniquely designed to be influenced by their peers. And so if you tell them to take medication because they have sickle cell or diabetes and they got to take it at school, they're probably not going to take it, right? At least at first, because they don't want to be different. And so it is our job, if we really are trying to empower them, if there are regimens that they can be on that is outside of school, before school or after school, whatever it is. And although it might not be a typical one, but we really have to be mindful of this. So although an adult might say, I don't care, I'm going to take my insulin at work at lunchtime because I have diabetes. An adolescent, at least in the beginning, might not be so willing to do that. And so if we really are trying to empower them to make better decisions regarding their health or whatever, we have to be mindful of where they are in the stage of development, and being influenced or being wanting, to fit in with their peers is part of their normal brain development. We cannot undo that. Some people will get through it faster, but we have to know that it exists. So brain connectedness has its own journey. And so, like I said, I got a 3 and 5-year-old, so I got a brain that's on my furthest left. And we are trying to move to this beautiful purplish blue brain that is fully connected and matured. And it's so funny because a lot of times I'll ask the residents, so what about teenagers is so different? They were like, their frontal lobe. And I was like, is it absent? Like, do they not have one? Is it like Phineas Gage where it's gone, a hole in it? And they're like, I don't know. I'm like, no, it's there. And they have it. They can access it. That's why in the room, they can tell you all these very, important things, safe sex, no drugs, all the things that we want them to hear. I eat all my fruits and vegetables, right? So they're able to tell you those things. They know risk and they know things that they're supposed to do. But when they're upset, when they're sad, in the heat of moment, when their peers are around, that connectedness to be able to access that part of their brain that helps them think about consequences and think about things, they're just able to access it slower. And I don't know if any of you have the experience, and I know Dr. Caskey does, seeing an adolescent that you start seeing at like 12 or 13, and now you're seeing them, they're like 18 and 19, you're like, huh, I remember telling you that 8 million times when you were younger. You never listened to me, but now you're getting it. And it is so fulfilling because you're like, this actually does work. If I keep saying the same thing over and over again, laying the groundwork of how to get them to do this, it's actually pretty magical when they're able to start accessing these parts of their brain better, that they really do start making their, I mean, like I had this girl, she was what someone would say is a train wreck. Like she had been in and out of like hospital, like just all over the place, never taking medicine, thrown away. And she turned 19 and I hadn't seen her for like a year and a half. And she popped in my clinic and I was like, hey, what are you doing here? And you don't have your mom here. They would like yell and fight in the office. It was bananas. And she was like, yep, I lost my insurance. But I remember you saying that one day that I would have to go and sign up for my insurance. And I did it on my own. And I signed up and I put you as my primary care doctor. And I was like, what? I couldn't even get you to come in on a regular basis. And you would fight and argue with your mother for like half the visit. And she was like, I know, I can't believe I used to do that. And I'm like, I did. But it was really, just supporting her, reminding her, giving her this framework until she started being able to make these decisions a lot better. So executive function is the part of the brain that usually is connected with last or latest in adolescence, which we need to be working when we're talking about empowerment. We're talking about working memory. We're talking about inhibition control. We're talking about flexibility and planning and reasoning and all those things that we want to work right away when we see a 14-year-old, 15-year-old in the office, but it does not work that easily. And we just have to remember that when we are talking to them. So transition to health is really important, and you guys will get a whole fantastic lecture on it after me. But it's one of the important skills that people develop during adolescence, and it's their ability to manage their own health care. And the reason that this is important, because I actually had one of my teenagers ask me, I was like, okay, so I need you to figure out how to refill your whatever medicine. It's like albuterol or something. And he was like, why is that important? I was like, it seems like just a random task that I'm asking you to do. And a lot of times we ask adolescents and young adults to do things, but we don't explain it to them. And as we're talking about transition of care and we're talking about empowerment, we don't do that with adults. Well, we shouldn't do it with adults. We don't just say, go pick up this medicine. And if they ask why, we don't explain it. And when they're little kids, we explain everything to the parents. But I find that there's this space in adolescence that sometimes we forget to explain things to them and allow them to ask questions to us. Because if you give them that space, then they're usually more likely to do these things if it makes sense. And so I talked to him. I was like, what we really are trying to do is decrease the fact that you will have bad outcomes later. So if you learn how to refill or pick up your albuterol now, that'll be a skill that you'll have when you get older. And if something were to ever happen to one of your parents where they can't go get it, or if there's an emergency, or while you're away at school and I need to refill something and you need to pick it up, you have already started practicing that in high school. And he was like, oh, I guess I never thought about that. And we know that this increases health literacy and understanding. So as we talk about the health disparities that continue on into adulthood, when our patients sit there and you feel like you are pouring everything out about explaining everything and they walk away and they're like, I don't know what the doctor just said. the more adolescents get practice of it when they're younger or as they're transitioning through adulthood, it increases this understanding as when they get older. And then, of course, developing other life skills that are necessary to succeed in adulthood. So, we're setting the framework in the form of adolescent health and health care, but we know that if we are able to work on this with them within the setting of a healthcare arena, that they're able to translate that into other aspects of their life as well. All right. Hopefully this doesn't work. I just like the video because I think it's cool. You guys see the cars moving? I think it's cool. Anyway, so empowering is a two-way street, which is how I opened up. So this is not just a lesson about telling teens what to do and how to, I'm going to give you some like special pearls because I'm an adolescent doctor about what makes adolescents so empowered, but it really is reminding us of how to empower them. And so it's a two-way street. It's them and us and them. So in other words, it's a gradual process towards increased independence, and it should be placed in a supportive context, which I think sometimes we forget. Usually, especially if an adolescent has younger siblings, a lot of parents are just like, all right, you're old enough, so I need you to, fly out the nest, learn how to fly on your own, because I have these younger kids that really, really need my support. And although it would be great if it was that easy, it is not. And so there's a lot of research that shows that adolescents who display like assertiveness and independence in family decisions while also staying connected with their parent, they display better psychosocial adjustment as it relates to like higher self-esteem and social competence, friendships, romantic relationships, and even healthcare, right? And so it really is just allowing them to do things while also supporting them without being frustrated and watching them possibly do things over and over and over and over again until they get to a point where they're able to receive it. And sometimes that takes us telling that to the family and patients as well. All right, so I'm going to take 2 seconds and put it in the context of a comprehensive adolescent exam. And I'm going to walk through the way that I've been doing this so long that I didn't even realize that it was like a thing. And one of the residents pointed out and was like, oh, I like the way that you set this framework in your adolescent visits. And this could be in a well visit, this could be in an acute visit. And so those of you guys who are like seeing younger kids and you're transitioning to seeing older kids, it really is important to start practicing setting the frame of the visit. So in a comprehensive exam. And so usually when a patient comes in, I usually greet the adolescent first, right? Because a lot of times we go in, especially if it's a parent that you've been taking care of, this might be harder to do. If it's a new patient, it's probably a lot easier to do. So let's say the patient's name is Rick. So I go, hi, Rick, how you doing today? I confirm their name, date of birth, all the rest of that stuff. And I was like, do you know why you're here? A lot of times adolescents look at their parents or their parents will just start talking. And if their parents start talking, that's fine. I give the parents space to talk, but then I direct my questions back to Rick. I go, Rick, is that true? You came here because you need a sports physical? And a lot of times they're surprised because most of the time they're on their phone, they're scrolling, they have their ear pods in, and they're just not used to the fact that someone has greeted the teen and asked the teen why they're here, right? And so these are little tools that you can use so that you develop the framework that Rick knows every time they see me, I'm going to talk to him first and the parent can fill in the blank. And it also helps when you're transitioning to do your confidential assessment because all of your questions are being aimed towards Rick and you're getting input from the parent. But as you shift to have them step out the room, it makes it not feel so odd. Because if you direct all the questions to the parent and then have the parent step out the room, it's just like, okay, you've asked me all these questions up until now. Why do you want me out the room? But I usually greet everybody, talk to the adolescent, ask them why they're here, and then get input from the adults. I explain the structure of the visit to the adolescent, especially if they're new. If they're like an old time patient of mine, I still kind of reset. I was like, you know how this is going to go. I'm going to ask you a lot of questions. Your mom or dad is going to go out the room and they're like, yeah. My patients that have known me for a while, they laugh. The new patients, they're usually really surprised because I'm explaining to the teen what I'm going to do. And of course, spending some time with the parents is important. You get the parents' input about why they're there, what they're worried about, that rash, that mold, that bump, that acne that the teen doesn't care about. If it's something like that, it's so funny because a lot of times parents will point out things that the teenager don't care about at all. That acne, it's just getting bad. He's trying this, whatever. And I go, Rick, does the acne bother you? And he's like, no. I was like, because there's a lot of good medicines for acne, but you got to take them for a little bit of time. So if you're not really bothered by the acne and it's not like scarring acne, we got to figure out if that's something you want to improve, or is it something that your parents just want to improve. And usually they laugh, right? Because the parents are also not used to giving that space to the adolescents, because up until now they have been the guardian of the information, the one making the visit, the one making whatever. And I'll go through this through the rest of the visit. But even at the end, when I'm trying to do a schedule appointment, I go, Rick, all right, there's a lovely receptionist out in the front. Her name is, if I know some people in the front, I'll say there's Sandra. Sandra's out in the front. I want you to go find Sandra. I need you to go tell her that Dr. Scott Wellington told you that she wants to see you in 3 months. And then you ask Sandra to schedule an appointment. Can you do that? He's like, oh, my mom usually does it. No. I want you to try. Like, if it doesn't work out, your mom's right there. She can help you out. But I want you to try. If there's any problems, you can tell Sandra to epic chat me and I'll come help you. But I want you to try it. And so I usually do that a couple times. First time they're usually like, yeah, whatever, that doctor's crazy. I'm not going to do it. But usually after a couple trial runs, they kind of like get used to that experience. If I can get them to sign up for like their Epic app, to get my chart, I'll tell them like, look, you can see my schedule. You can see that I'm free. You can book your appointment. So we start working on that as well. So I start giving them like little tasks to do as I talk through them in the visit. And of course, it's appropriate to spend some time with the teen alone, discussing all the confidentiality and consent rules. I think you guys talked about that a little bit in the last lecture. And then giving some one-on-one time. I give one-on-one time with the parent and I give one-on-one time with the teen. I know that sounds like a really, really long visit, but I have a little more time on my visits. But I usually try to have everyone's voice be heard so I can figure out, what we need to do. And of course, the better I know the patient, the faster this goes the next time. For those of you guys so I feel like everyone does different risk assessments. In our clinic, we do the shades or the heads assessment. Some people do GAPS questionnaires. But I was trained on the heads assessment, going through like various different like home, education, eating, and all the rest of that. We have started to shift more into trying to use the shades assessment. I like it because a lot of times adolescents really aren't asked about their strengths, unless they're like a stellar, like I'm an A student, I'm an athlete, whatever. So those people get talked about a lot. And so it's usually easier for them to share what their strengths are. But the ones that are like, average grades or failing or struggling with whatever, or feeling like they don't know what they like or what they want to do when they grow up, asking them about their strengths is not something that they hear often. They usually hear all the things that they're not doing. And so I usually start off with what their strengths are, because for me, it helps me remember the things that they're connected with when I'm talking about empowerment. So if it's something, so I'll even sometimes make a comparison like, oh, you're so good at video games. You should be able to get on the app and like, be able to send me a message and do all the rest of it. If you're so good with technology, you should be able to do that. So download the app, be able to message me, be able to make appointments. Sometimes they laugh and they're like, it's not the same. And I was like, yes, it is. It's technology. You are good at technology and you should be able to do this. Or if it's something else that I might need to do later, we have this research program that's going on in our clinic, which is talking about like coping and using coping mechanisms. And they do it through like a video game type platform. And so some of my patients, I'll say that like, all right, so you told me that you're struggling with your mental health, but you're really, really good at like video games. This actually program, plays into that strength of yours. And it might be something that you might want to enroll in. And so for me, that's really important for me to go through the shades assessment, starting with strengths, because it allows me to figure out what type of things are going to play in helping empower them just become more independent. As I go through the shades assessment, I usually ask not just about like things like home and activities, but I also ask what tasks and what responsibilities they have underneath this umbrella, right? So the typical home questions is, who do you live with? Do you feel safe at home? All the rest of that. But I also ask them like, okay, so when you go back and forth to school or whatever activities you have, how do you get back and forth to school? My mom drives me. I take the bus. Oh, how many buses do you take? I take one. How long does it take to get on the bus? What about if you're late to the bus? What do you do then? And you'll find that some of my patients, they have some very long journeys. And, when we're talking about independent things, when the parents said they can't do anything, I was like, they take an hour and a half bus ride to school each day. Some people can't do that even when they're adult. That's pretty impressive. This kid can, be encouraged to do more things. If they're working, what do they do at their job? So a lot of times we stop when they say, I work at McDonald's. Oh, okay. What do you do? And then look surprised. Oh, I'm a cashier. Oh, you're a cashier? That's awesome. Do you ever shift out to other jobs? Yes. Okay. What does that do? And that just tells you, again, their level of independence and things that they can do. Do you wash your own clothes? Who washes your hair? I think that's such a important question, because it's funny because a lot of adolescents and young adults still have their parents washing their hair and they're like 18, 19 years old, right? And that is when you start empowering them to do things at home, you can empower them to do things with their healthcare. But if you want them to pick up their prescription and you're still cutting up their food, true story, one of my patients, I was like, Dad, you still cut up her chicken? She's 18. Like, you can't get mad because she doesn't pick up her prescriptions for whatever, but you're still cutting up her chicken at dinner, right? So like these things need to fall in line together. Although I'm talking about adolescents as if they're like this group that is all the same, we know that they are quite different, right? So some people need things that others don't. However, there's been a lot of studies about like what makes adolescents successful, what makes them transition, what makes them, be set for dealing with the roles of being an independent, autonomous adult. And adolescents really, when looking at the various, and they were looking in like transition clinics. So some of them with HIV class, some of them transition clinics as far as cancer patients. And although they came from different backgrounds with different pathology and disease and in different countries, many of them agreed with two things that they need, which helps in their journey through transition and helps with their empowerment. One is they want and need to be treated with respect. And so if you really are trying to get them to do something or to take control of themselves and you're talking to them and they feel like they're not respected or that you're talking to their parent, they don't receive the information the same way. And then two, setting a place where their confidentiality is maintained when possible, right? And so being as mindful as you can of their confidentiality, because I feel like we do a really good job, or I don't know, I'm not an adolescent, I'm not an adult doctor, but adults have their own kind of like barriers put in place. Like you can't come into the office and ask, like my dad, although he's my father, I cannot roll into his clinic and be like, give me my dad's chart. I want to go through it all because I'm a doctor, I'm his daughter. Right? Somebody might do it, but they shouldn't do it. There's all these like guidance to protect them, right? But adolescents, depending on which clinic you work at, the structure of your clinic, they don't have that same protection. And we talk to them a lot about transitioning into adult, but then when we have scenarios like that, we don't treat them in the same way that we would adults. And so what they say helps with that transition is that they need a space where they're respected and where their confidentiality is maintained. And so this is important when we're talking about the growth and development of adolescents. They need things like age appropriate comprehensive education. They need development of life skills. They need health services that are acceptable, equitable, appropriate, and effective. And we'll talk about that in a second, because that's under the framework of adolescent friendly services, the WHO adolescent friendly services, and they need places that are safe and supportive. They also need opportunities to participate in design delivery of interventions to help improve and maintain their healthcare. And so basically that means that they also can provide input. So if we are trying to help them along with their journey and trying to help them become more empowered, we also have to be willing to receive input from them. So when they say things like, the reason that I didn't take that is because, one of my patients newly diagnosed with lupus, she has this prednisone that she's supposed to be on, and then she's supposed to be on taper. I found a pattern that every 7th day, she wouldn't take her medicine. Right. I was like, okay, so you took it this day, but not this day. And we were going through the dates. And I was like, it looks like every Sunday, or almost every Sunday, you're not taking your medicine. Why? And then the other provider that was in the office with me was just like, you need to take your medicine. You have lupus. It's going to flare, like all these things. Right. And she kind of just like zoned out. And I was like, no, let's go back there. Is this what I'm saying true? Because we just went through the last calendar and it looked like every Sunday or almost every Sunday you weren't taking your medicine. Why? And she was like, I'm on the church choir. I have to get ready. I'm the leader of this. I have to do this. I'm at church at 6 o'clock, all of this. And so she goes through this whole thing about like why she normally takes her medicine in the morning and Sunday is just so full of activities that she cannot take it. And I was like, so you realize that prednisone is not like birth control, although we want you to take it around the same time every day. If you come home after church, after your very wonderful day of serving, and you take your prednisone, it's okay. And she was like, I didn't know that. Someone told me that I had to take it at the same time every day. So I'd rather not take it than it to mess up my church time because it makes my stomach hurt and all the rest of the stuff. And so it really took having that conversation, right? So on one instance, you can say this girl is non-adherent. She's not taking her medication. She doesn't care about her lupus, all these kind of like negative frameworks that sometimes we give adolescents. But when she sat and talked to her, it's like, no, the barrier was the fact that she finds joy and meaning in doing this on Sundays. And so we now have to reframe it. Like, we just want you to take your prednisone. And if taking it after all this activity is going to get you to take it, I am totally fine with that. But had I not received your input, I would not have known that that was a barrier for you to become more independent and taking your medication the way that we prescribed it. I put these on here, and like I said, I think that this is a whole lecture in and of itself, and I won't bore you with the whole lecture, but these things are important. It was WHO defined these characteristics of what they call adolescent-friendly services. And these are important because it allows adolescents to receive services in a way that they need to receive them. And the more that these systems are put in place, the easier it is to help adolescents transition into that journey of taking on their own healthcare. When you have things that are like a patient can come into the front, they are, not asked if they are bringing a little sibling here. Like, so, I'm going to see, I always go to the front desk now. After that happened, I go to the front desk. When I come in, I go, you guys, I'm here in clinic seeing patients today. You know that I see patients up until 25. If any of my patients check in, just remember, they might not be here with a kid. They might be my own patient. Just want to remind you that I am here seeing patients that might be into their 20s, right? And so setting the framework, when an adolescent checks in, that front desk knows that that 22-year-old that might be on your schedule is a patient of the pediatric clinic. And that's fine, right? And when you are getting, vitals on them and all the rest of that, we are setting the scenes to provide services to this patient that I am trying to transition into adult care and they're trying to transition into adulthood. So if they ask you a question, if you're asking, like all the checklists, give them some privacy, give them some space. All these things are really, really important. Making sure that what we're doing is delivered in a way that respects them. So a lot of times we have, patients that come in and their gender on their name on their chart is wrong or their name is wrong. And so allowing them to have that space where we can correct it and change it, right? Because then they say, oh, this clinic, this provider, this team of doctors are so much invested in me that they care about looking at me as a person, as a young adult, as a person transitioning, that these tools that they're giving me might be important in order to help me be successful later. I also do this with a lot of the families as well. Like, okay, so as they start getting older, I know that a lot of times you come with them, but why don't you try letting them check in by themselves? And why don't you try letting them go get their vitals by themselves and come back to the room? And as long as I know that you're out there, I'll remind them once we get to that point in the visit to come get you. But see how they feel going through all of those stations by themselves, right? Because if you really one day want to have them take the bus and come see me or come see me after school, maybe you being in the waiting room while they try to go through all these stations by themselves might be something that they need practice doing. And maybe they won't get it right the first time or the fifth or the 10th. But if we keep on trying to encourage them to do that, we can transition into, allowing them to be able to do some of these things by themselves. Because a lot of times parents forget. They think like, I go with them, and then 18, I just like drop them off and they're supposed to figure it all out. And it doesn't work that way, right? So if you do everything up until they're 18, and then at 18, you drop them off at the doctor's office and they're supposed to figure out how to check in, or they drive themselves and they have to pay for parking or get parking validated. Like sometimes that gets confusing. And so they need a lot of like practice and trial runs. Um, Self-managing of healthcare amongst adolescents. We know that providers perceive adolescents themselves as an impediment to successful transition. But I'm here to tell you that it is not just them, it is us collectively, right? So the two-way street of independence. In an American Academy of Pediatrics survey, more than 80% of adolescent pediatricians reported lack of knowledge or self-efficacy skills. They thought that that was a barrier in transitioning, so successful transitioning, which basically means like I don't feel comfortable enough or don't have enough knowledge in like how to successfully transition my patients. And sometimes my patients don't transition because of whatever reason. And so I feel like this dynamic between both of us just makes it really, really difficult. And in a 2017 national survey about implementation of federally recommended healthcare transition protocol, which I think the next lecturer is going to talk about, providers reported that their greatest struggle was engaging youth and their families. So I put all of this up there because a lot of times people think that the youth not wanting to transition is the biggest hurdle in transitioning adolescents. And so it makes us feel comfortable. We feel like we don't do it well. And there's this like kind of like big guilt that we feel like we tried, they didn't want to, and now they are too old to see me, or now they're struggling in this adult kind of like world that we have left them in. However, I did find this like study that was done by Schweitman and her colleagues, which surveyed like over I think it's 1,200 youth from various different parts of the country, and just ask them various different questions like who makes your appointments, who picks up your prescription, how involved of you are you in your healthcare? Is that something you want to get more involved in? It was like a series of various different questions. And interestingly enough, they found that like 42% actually wanted to be more involved in their healthcare. And less than 7% wanted to be less involved. So teenagers actually, some of them do want to be involved. They just don't know how. And we don't really set the framework sometimes for them to be more involved. I really like these examples because I think it's something that we don't think about. And so you want an adolescent to become more independent, but we have to think about transportation, right? So who takes adolescents to their visit? Is your clinic set up in a way that an adolescent can get in and out very easily? Do they have to pay for parking? You know how many patients I have, and Dr. Cassidy can understand this. We are located on two relatively busy streets without like good parking on Wood and Taylor, and there's this circle driveway for drop off. You know how many of my patients park in that circle driveway and come up to see me in clinic and just leave their car there with flashes on because they don't know how to navigate the parking lot or how to pay or what validation means, right? So you're just like, oh, right. I didn't actually think about this when I'm talking about transition to healthcare. Your parent used to always drive you or dropped you off at that circle driveway, maybe even, and possibly stayed out there where you went upstairs. But now I'm asking you to come alone. And as we're talking about transition of pharmacy and knowing what medicines you're on and what medical problems, we never really talked about like, so how do you get here? Do you take the train? Do you take the bus? Do you drive? Do you know that they validate parking? Do you know what validate is? This is a barrier to them being empowered to do things alone. Because if I don't know where to park, I'm less eager to come and do my doctor's appointment by myself or to do things that are involved in my healthcare by myself. If I go to the pharmacy and the pharmacist, if I'm trying to pick up a confidential medication and the pharmacist calls my parent instead of me, that makes me feel that I am being excluded from the healthcare system. Possibly if I go see you and make my own appointment, I don't have a job where I can pay for a copay, right? So if it's not a well visit and it's an urgent care visit and I have a copay and I don't have money, that then reconnects me back to my parents. And I'm not sure how to navigate that. What about policies put in place for office visit? I heard you guys talking about that in the last session. Like how old do I have to be to come see you by myself? Right. And so, yes, confidential services, we're able to see them alone, but various different clinics have various policies put in place about who can navigate other visits. Can I bring a guardian can I bring someone who is watching me that's not my parent? Can my older sister bring me to a visit? Like all these other things that we don't talk about with our patients. And as we talk about them, taking over control of their healthcare, there are really systems put in place that might serve as a barrier to them being fully independent or going through that journey of independence. And we need to start troubleshooting that with them. When discussing why they wanted to become involved, most youth talked about their desire to become more independent and take control of their life, which they really do want to do. So they want to become independent. They really just don't know how. And a lot of their independence is not happening at home as well. Like they want them to do laundry and wash dishes, but when they say, "Can I take an Uber and go, to a friend's house?" And although the answer still might be no, adolescents don't feel like, okay, so I can be responsible and like clean up, but I can't responsible and like navigate the city by myself or navigate going back and forth to school by myself. And so sometimes when I'm talking about healthcare, I have to like take a step back and say, okay, mom, dad, what else do you let them do independently? Because if I am struggling to get them to pick up their own medication or make their own visits or follow-ups, there must be other things at home that you are struggling to get them to do. And we need to work kind of like twofold on trying to get them to become more independent overall across the board, because these healthcare decisions then seem easier when they start being able to make other decisions. And of course, they will need some support. That's why we're there. And so all of this, of course, really is just to remind us that adolescence, it's a journey, right? So they're journeying through adolescence. They're learning how to do all these things that adults do a little bit better. They are still emotional. They will still make mistakes. But the more we encourage them to try over and over again, the more we give them more and more responsibility, the more that we talk to them about decisions, the more that we include them in on decisions. So when you are choosing a medication, when you are choosing a birth control, when you are choosing to vaccinate, most of the time they say no, right? Like, I don't want a vaccine. But like, look, but let me tell you, if you really are trying, not to get sick so that you can go to prom or whatever else, things that they actually care about, this is a way to protect you. We really do want to encourage you to be protected against whatever. And so you should do this. And if they say no, sometimes part of their empowerment is us respecting their no, right? Because just like if in the conversation previously about HPV vaccine, when a parent doesn't want you to have it, you respect that because you don't want there to be static between you and the family later, right? And so maybe as they get older, it might be a space to revisit it. But what happens when an adolescent says no? And again, there's some settings in which you might feel like their no might put them at risk, and you can explain that to them. But sometimes we also need to give them space to say no, because sometimes they just are testing us to see if we respect their no. I've had patients a lot of times tell me no, and then a couple of minutes later say yes. Like, oh, I thought you were going to make me do it. I was like, no, I'm not going to make you do anything. I want you to do it. I think you should do it. I would encourage you to do it. But you told me no, and I have to respect that, although I don't like it. Right. And think about how many times adolescents and young adults hear that. They don't really, not many of them. Most of them hear no, and no is no, right? And they don't say, all right, I'm giving you your space and I respect the fact that you made that decision. And I'm going to ask you about it next time because I really think you should do this, or I really think you need this. But I'm also going to respect your autonomy because I want you to become autonomous later. And so I have to give you practice in using your own voice. And so we have to be active in promoting young people's participation in their healthcare through every stage of it. We have to be supportive of their decision-making about their own health. And again, setting in the framework of adolescent development. Some adolescents really are not aware of kind of like the breadth of consequences. And sometimes it might be sitting down and trying to explain age appropriate like risk of whatever behavior that they're doing. Sometimes it's risk reduction, which us in adolescent medicine are like the king and queens of. We're like, okay, so you're doing that. Okay, maybe we will just help you, find a way to reduce the risk of whatever that very risky thing that you're doing. And that is a win in our book. Seeing them as true partners of change, because I think that, as they are transitioning into adult, there's not really many arenas where people look at them in a partnership. They still are looked at as being kids that are being told, but like trying to transition your role with them as well. So we are coming up with this plan together. What should we do about it? How should we tell your parent about this? I had a patient yesterday, 18 years old, just found out she was pregnant. She started crying. She's like, my mom's gonna kill me. I was like, all right, so what do you want to do? Do you know yet? And she was like, I absolutely want to keep the baby. I was like, all right, so do you need help telling your mother? How do you think we should frame that? Do you want me to help you like that? And she was just like, oh, I guess I never thought about that. I was like, you have to do the talking, but I will be here to support you in that conversation, because that is a grown-up, decision. That is a grown-up conversation. Howsoever, I understand that could be scary. And so I can sit here as you figure out the words to tell your mother. And shifting the paradigm to collaborating with them, right? So collaborating with them versus speaking for them is what I would say, because we really are just trying to make sure that their voices are being heard. And as long as it's not in a way that is going to negatively affect them, really supporting them to be empowered to do stuff. Because what we do know about adolescents is if they come to the decision of doing something and they make their mind to do it, it usually is something that is more long-term than feeling that they are being forced or told by someone else. And these are my references. And hopefully I didn't talk too much. And I'll stop sharing.
Thank you. That was fabulous. A few questions in the chat I'll go ahead and read. And I'm going to actually combine two of them. I'm curious how you schedule your time for adolescent visits. Do you schedule more time for well visits versus acute? And maybe if you could also answer the second question, which is any pointers on how to fit in an adolescent well visit into a 15-minute slot?
I know. So that's why I gave the disclaimer, because I knew I was saying. So I am very fortunate enough where, yes, my visits are 30 minutes. So I have more time and space to do that. And I know that not everyone does it. So usually, and I have worked in arenas. So I was at a UIC affiliated federally qualified health center on the South Side for several years when I first started working here. And we got 15-minute slots. And so usually what I do is I try to do a lot of things together. So adolescents, once they warm up to you, they're able to, as I'm doing the exam, so I'm doing the exam and I'm talking to them about whatever. But I'm also looking at them. So what tattoos they have, what jewelry they have, earrings they have on. And as I'm talking through this, I'm also doing a visit. And so that's what I started doing when I had less time to kind of navigate all this space. I started trying to all right, I'm sorry that I'm going to be doing your exam and ask you some questions. Are you okay with that? Sometimes they just want permission. And so I'll start the exam as I continue to kind of just find out more about them and ask them some of these questions about what they do and what they don't do. And I have found that most of adolescents are okay with combining both, because half the time they want to go too. So they're okay with it, with me combining two. But yeah, I have more time in my clinics.
That's great. And you're getting also, just so you know, some several just positive comments in the chat about your talk. Another question, have you found in your practice or in any studies that patients are more involved, independent, or health literate when their caregivers don't speak English?
So I have found that, but that's why it's even more important to empower them to become independent. Because although we don't like the notion that the younger adolescents or teens will need to help their parents, grandparents navigate the healthcare, we know that it's true, right? We know that it's true. And we know for the time being that is a role that they probably will play. And so the more that you can get an adolescent to be first more health literate, to ask questions, to be able to navigate the system better, the better they are, or an advocate they are for whomever they will help out later. So I definitely do see that. And that's why I usually spend a lot of time in making sure that our patients that come in with their family who's non-English speaking, you have to ask questions, because I really need you to understand this, because you might go home and your mom or whoever might have questions, and you need to know how to contact me if you have questions, or ask questions to the pharmacy if I'm prescribing a medication that when you get home, your family look at it what is this? And so I'm very mindful of making sure that there's extra special care, because they might have more on their shoulders later. It might not just be empowering them to take on their healthcare. They might be taking on other people's healthcare or helping them manage it too.
Implement time alone with both the parent and youth. Do you see the parent alone before alone time with the youth? And then it sounds like you also suggested a wrap-up session at the end of the visit.
I know you guys are like, we can't do all this in 15 minutes. I am not asking you to either. Some of it might be a buildup, right? So you might like doing the first visit, get some of this, and then the next visit do another. So the way that I do it, again, I have more time. So everyone's in the room the first time, and then I kick the parent out. And as I walk to the waiting room, as long as it's not like super confidential, we kind of just have like a chat. Anything you're worried about? I'm going to go see Rick alone. Anything I should be mindful of? You know, and the parents will like say whatever. And then I retrieve them as I'm bringing them back, and I do the same thing. So everything looked okay, but is there anything that we should talk about before we go back into the room with Rick? And sometimes parents are like, yeah, I just need like 5 seconds, and I'll go quickly try to find a free room, and they'll give them their 5 seconds. But if they're like, no, if you didn't find anything and there's nothing that you're worried about, then I'm okay with rejoining. So that's what I do. I do my like conversation as I'm walking out, conversation as I retrieve them, and I only like pull them out to have a separate conversation if the parent's like, the tearful parent that's like, I didn't want to say this in front. Or if there's like conflict in the room, like if they're like, I always separate them, because I was like, there is something else there that I need to at least know about, or at least some layers of it, because you guys are like at each other's throats, and there's more than what I'm seeing here. So yeah, that's what I do.
And one last question, although I do think this might be addressed a bit in the next talk, but please review process of transitioning patients to adult care who are intellectually challenged, including process of parent to continue guardianship of the adult patient.
And only because I snuck and read the next lecture. Yes, it is covered in the next lecture. It is, it takes a lot of time and support, and you having knowledge. So I have had one of our doctors at UIC, Dr. Hickey, I've had her like go over it over and over. I was like, okay, so guardianship, how do I do that? When should I be? Okay, what is, like, I have to repeat it and review it myself over and over again, because the interesting part about it, although we want our patients to come in every year, we know that that is not true, right? And so sometimes you might like see them at 14 and you're like, oh, I forgot to talk about puns and guardianship and all the rest. And the next thing you know, they come in, they're 18, right? And you're just like, ah. And so I think it's a very delicate balance. I start early. I usually have like my resource dot phrase, so it reminds me, but it is in the next lecture. But I usually say it is never too early to start, because parents get so overwhelmed sometimes with the transition into adult care of those patients.
Dr. Scott Wellington, thank you so much for an incredible